Hi everybody, my name is Sarah Wright and today is June 1st, 2022, and today I'm going to be talking about the integumentary system. The integumentary system is made up of the cutaneous membrane, or the skin, and its accessory structures, such as the hair, sebaceous and sweat glands, and nails. Some of its functions include protection from the environment, thermoregulation, and its involvement in the body's immune response. Its layers are the epidermis, dermis, and subcutaneous layer, also known as the hypodermis. Starting with the epidermis, which is a stratified squamous epithelium, it contains 5 layers as well as 4 cell types. Its 4 cell types include keratinocytes, which produce keratin, melanocytes, which produce melanin, Merkel cells, which are involved in sensation, and then Langerhans cells, which are involved in the body's immune response. Starting at the deepest layer is the stratum basal, which will have large stem cells, or called basal cells, as well as Merkel cells and melanocytes. Then there is the stratum spinosum, which will have keratinocytes that have large bundles called tonofibrils that are involved in cell connection between the keratinocytes and its neighbor. Then there is the stratum granulosum, which will have keratinocytes that produce keratinohyaline, and then the keratin fibers will develop. Then there is the stratum lucidum, which is only present in thick skin, such as that on the palms of the hands and soles of the feet, and is a glassy layer. Then there is the stratum corneum, which is going to have dead and flattened keratinocytes. Then moving to the dermis, which is going to have loose connective tissue over dense connected network of connective tissue. Specifically, it's going to include the superficial papillary layer, which is going to have a mechanism that connects it to the most superficial epidermal layer. And then there is the deeper reticular layer, which is a dense connective tissue network that surrounds things such as blood vessel, hair follicles, sebaceous glands, and sweat glands. And they are connected by collagen fibers. Then there is the subcutaneous layer, which is also known as the hypodermis, which is going to stabilize the skin but still allow for independent movement, and it also serves a purpose in fat storage. Then, connecting this to a clinical setting, I want to be a PA specifically thinking of specializing in trauma, and one of the things I think of when it comes to trauma is burn victims. And connecting this to the integumentary system, I would need to know its mechanism as well as its layers, as I would classify that degree of burn based off of how deep or which layer that burn affected. For example, if I wanted to classify a burn that affected only the epidermis, that would be a 1st degree burn. And then going down the line to 2nd, 3rd, and 4th being affecting all 3 layers and possibly more structures, it would be very important to understand which layers and how to identify them in the skin on a body. And then there I can process or develop process of treatment as well as clarification or classification of that degree burn. Thank you.